Kia ora koutou, good afternoon everybody. I'll begin with some good news that once again today there are no new cases to report in the community and just one case in managed isolation. We'll get into the usual daily update shortly, but first we turn to our vaccination program. As of today, 18,000 people will have received their first doses of first dose of the Pfizer vaccine, with the initial focus having been on our Covid-19 frontline border workforce and now on their families. Yesterday afternoon we received the fourth batch of our Pfizer-BioNTech vaccines. That shipment of around 64,000 doses arrived as air freight at Auckland International Airport, bringing the total number of COVID vaccines we've received so far to around 265,000, enough to vaccinate more than 132,000 people with the 2 doses required to get maximum protection. All of this has us in a very strong position as we move to provide details of the sequencing of our vaccine rollout, the focus of today's announcement. So today I'm announcing a targeted rollout over the next 3 to 4 months, initially focused on the 2 million New Zealanders most in the most at-risk groups. These are the New Zealanders most at risk of getting and spreading COVID-19 and those most at risk of getting seriously sick from it. Our plan also has a focus on those who live and work in places where they're most likely to pick up COVID-19. I can confirm that over 65s and those with underlying health conditions in South Auckland will start being vaccinated from the end of March. This plan further reduces the risk of future outbreaks, something that's been central to all of our government planning and prioritisation during the pandemic. We've been able to fully focus on this plan and the sequencing framework after securing enough Pfizer-BioNTech vaccine for everybody in New Zealand to get 2 doses that they need to be fully vaccinated against the virus. It's a balanced plan that prioritises reducing the chance of future outbreaks whilst protecting our elders, those with underlying health conditions, and those who live in locations where we know outbreaks have occurred. We've seen the devastating impact that outbreaks in residential care facilities can have here and overseas. That's why this group of New Zealanders will start getting vaccinated later this month. Then all older New Zealanders aged 65 and over will be prioritised to start getting the vaccine from May. The vast majority of our COVID deaths have been people aged over 65, and we do note that that is a critical group to get vaccinated early. It's estimated that those over 65 have a 5-fold increase in risk of severe health outcomes if they were to get COVID-19. So there are 4 main priority groups. Group 1, where we're well underway, is our 50,000 border and MIQ workers and their household contacts. This started last month, and the vast bulk of that phase 1, that group 1, will be completed this month with at least their first dose. Group 2 is approximately 480,000 frontline workers and people living in high-risk settings, starting with 57,000 healthcare workers on the community front lines, and then moving through healthcare workers protecting our most vulnerable and some of our priority populations. This work also started in February and will continue through May. Group 3 are our priority populations. So this is approximately 1.7 million people who are at higher risk if they catch COVID-19. That group we plan to start vaccinating in May. And then Group 4 is the remainder of the New Zealand population, the approximately additional 2 million people that can expect to start seeing vaccines available to them from July. I want to be clear here, some of these dates may overlap and shift slightly as our modelling continues and also as we get greater certainty of our delivery schedule for vaccines, and conversations with Pfizer, particularly around those big bulk of deliveries we're expecting in the second half of the year, are ongoing. I want to reinforce that every New Zealander will be able to get a vaccine and that the vaccine will be free. The rest of the population will be able to be vaccinated from July onwards, and our plan is to have as many people as possible vaccinated by the end of the year. In further detail, approximately 40,000 courses are being allocated to our Māori and Pacific health providers who are working directly with older people, and as I've said, we're also recognising special circumstances in South Auckland. Anyone who lives in the county's Manukau DHB area who is 65 and older, or who has an underlying health condition, is in Group 2. This recognises that there are many border operations and MIQ facilities and their workforces that are based in this area, and therefore they are at increased risk. There are two further categories that we are still working on. One for people who may need to get a vaccine on compassionate grounds, and one which we're calling the national significance category, which could include people who need a vaccine in order to represent New Zealand overseas. Decisions around these categories have not yet been taken, but I will be taking more detailed proposals on those to Cabinet in the coming weeks, and we will share those as soon as those decisions have been made so that people can transparently see who is getting a vaccine and why. In closing, the message here is simple. This plan reinforces the importance of New Zealanders getting vaccinated. Getting vaccinated is the best way to protect our whānau, their lives and their livelihoods. The biggest factor in lifting COVID-19 restrictions will be timely and high uptake of vaccines. Again, it takes an enormous amount of work across a very wide range of people to roll out an immunisation program of this size, the largest such undertaking New Zealand has ever undertaken. And I want to thank everybody who has been involved in getting it to this point and who will be involved in the work that we take forward from here.